Well, hello, friends. I hope you're having a wonderful week so far. This is the Intentional Living podcast with Emlah. And today's guest is a wonderful friend. And I cannot even explain how near and dear she is to my heart. Like, Jessica, thank you for being here.
Thank you so much.
So, Jessica is a pain management pharmacist. And who I'm going to hold off on the pain management aspect for a little bit and just say how your passion for patient care like shone through the COVID pandemic.
Oh, thank you. Yes. We did
We
a
had
lot.
so much fun.
We did. I hate to say fun in relation to COVID, but we
Like,
really
it
made
is-
the best of a terrible situation.
In difficult times, you find
Yeah.
the people in your life who will support you
And
through
we
those times.
linked arms and said, let's do it.
Yes, shoulder to shoulder. But let's not skip ahead of ourselves.
Okay.
I just get very excited when I'm around you, but I need you to properly introduce yourself.
Okay.
Tell people why you have your degrees and everything, like how you came to this. Yes.
So long story short, so she already said I'm a pharmacist. I have a PharmD and I work in pain management. And I ended up here because I'm also someone who deals with chronic pain. And I lived experience have had times where I was disregarded, dismissed. My condition was is stigmatized, and this isn't the only stigmatized medical condition. There's plenty of others. I just happen to have personal experience in this one. And from the time I became a pharmacist, maybe even before, I thought there's got to be a better way to do this. And I want to be part of a better way of caring for people who have chronic pain. And you may think, why didn't you become a doctor? Well, it's because I gag too easily. So I figured out a way to help with pain without having to deal with things that are going to, set me backwards. So I became a pharmacist. And so I've made it my mission with every patient encounter to be different than what I experienced and sometimes still experience.
Thank you very much for that. Thank you very much for that. What better way to have, she's a doctor of pharmacy, but she is a patient, she is a mother, she is a wife, she is a community catalyst. So what better way to have all of that in one person and be the caregiver for all our patients? Like, if I'm in pain, I would like for you to take care of me. So I want you to be able, because you just don't give medicines to people. You explain to them. And I forgot one thing about her that I need to mention. She is one of the pharmacists nationally who speaks at APHA. APHA is the American Pharmacists Association, and they do an annual conference where they get together all the pharmacists in the U.S. They come together annually once a year and do their CE, continuing education. And Jessica usually provides education there on pain management, palliative care, hospice care, and things like that. So she is an educator at heart.
I am.
So,
yes.
And you work at a VA, it's everything.
Yes.
You're passionate about and married to a veteran, aren't you?
And I'm a veteran.
And she's a veteran. Like, it's... So there. Okay, let's pause on the introduction. Otherwise, we'll spend the whole episode introducing you.
No, yes, we should probably stop.
But I'm honored. I'm honored to be your friend and to work with you to care for the people around us and to care for our community. During the COVID pandemic, she sent me a text, which I'll never forget. She said, Emlah, I am here if you need me. The only thing you do is call. Yeah. And when I called, she did not come alone. She came with another physician, not just one physician. She brought a couple of physicians, other pharmacists, and other people to help us immunize our community. When I talk about building immunity in our community, she is the epitome of that. Like, she came in hundreds and hundreds of vaccines. I cannot tell you.
Oh, many vaccines.
Yes, but it makes our heart happy because we're keeping not only our children safe, but our friends' children and our entire community and all our families. Yeah.
And I still think about that.
Yes.
I still think about what we did and how, if you've never been in the pharmacy, it's not huge. And so we had people snaking in places and we were like, and we're going to put this stuff over here. And we had 4 or 5
immunizing stations,
to vaccinate people. and have people inside because some days it was cold.
Yes.
And so it was just
having hundreds and hundreds of vaccines every day, and makes my heart happy because our people want to be immunized, our people want to build immunity in our community.
Get mad.
Yeah. That's they're patiently waited. Yeah.
It was so amazing.
We are surrounded
to see
by a
that
good community.
Happen in a time when everybody it was stressful.
Yes.
So it was just a really cool experience.
Yeah, but switching gears to the topic of our discussion today, which is pain management. You know, pain is something that we don't talk about. On a scale of 1 to 10, what is your pain? You know, and you give a number and then you sit there. But there's no really way that you can measure pain. Mm-hmm. We talk about pain. And just tell me, you know, you talked about what led you to helping pain. When you see a patient who is in pain, nobody wants to be in pain. You figure out a way to take care of them.
Yes.
What are some of the steps that you take in caring for your patients?
I actually hardly ever use that 0 to 10 scale, which is starting to become more of the norm because a number is great, right? Figuring out severity is great.
Yes.
Finding out, but sometimes I'll use, is it mild, moderate, or severe?
Yes.
How bad is it? Is it better or worse than the last time we talked?
Yes.
So that's how I get to severity. But most of the time it's just, I want to hear their story and how they ended up getting in front of me. And so we talk about what I really opened it with introducing myself and then saying, tell me about your pain. How does it affect your life? What would you hope would change?
Okay.
And then I stop.
I love that.
And so, it opens a conversation instead of a directive from me, which I really like.
Okay. So we know about all the medications that are typically used for pain, all the NSAIDs, all the steroids, and all the opioids and everything. But there is low-dose naltrexone, which is used for pain, which is not so popular. But I would like you to school us on low-dose naltrexone. What is low-dose naltrexone?
So we can't talk about low-dose naltrexone without first talking about
naltrexone,
the available dose of naltrexone. Right?
Tell us.
It's available in a 50 milligram capsule or tablet. I can't remember if it comes in tablets or capsules. 50 milligram strength. And it's used to treat opioid use disorder and alcohol use disorder. And what it does at that dose is blocks kind of the pleasure response of utilizing those medication or those substances outside of, what they should or should not be, what it's supposed to be used for. So if someone is struggling with that, an option is medication-assisted treatment. And sometimes people use low-dose
naltrexone.
Full dose naltrexone, 50 milligrams. What we have found, and not I didn't find it, but we as a community in pain, is that at a low dose, and when I say low dose, I mean 4.5 milligrams instead of 50, right? So
very low dose.
Much smaller. It has this paradoxical effect. So like kind of the opposite effect of what you would expect. And that is that it calms down the nervous system without getting all down the science rabbit hole. It calms down the nervous system. There are little cells around our nerves that are kind of like, I was thinking about this on the way here. It's kind of like the hype people, so you have those people around here, they're like, woo!
Yeah.
And then everybody, it gets contagious and then everybody gets excited.
Yeah.
So it's these cells, and if we can calm them down, then the nerves can calm down.
Yes.
Right? So at low doses, that's what it does. And you won't necessarily see it used first line. So the first thing we reach for in neuropathic pain, but it's there as an option. And there are several studies that have shown for some people with disease states such as fibromyalgia or refractory neuropathic pain, so meaning the neuropathic pain did not respond to anything, that trialing low-dose naltrexone can be effective for helping them get back to a place they want to be function-wise, interacting with their family-wise, like all of the things that pain takes away from you.
Yes.
Starting to get that back. The caveat is there's stigma, right? If people know about naltrexone, they may automatically think, but I don't have an opioid use disorder and I don't have an alcohol use disorder. So it's really important to be able to explain the difference in the strengths and how they work. So at that low dose, it doesn't block those receptors and block that pleasure center. It doesn't inhibit or, change how someone might crave something. At low doses, it simply affects how your nerves are responding, can allow them to calm down. The pain can calm down. And then that's one aspect of starting to feel better.
This podcast is sponsored by Journeys, your path to intentional wellness. Most health problems don't start overnight, and neither does wellness. With Journeys, you can take charge of your health before you have to. Every cell in your body is speaking to you. But when we ignore preventive medicine, we wait until those cells are screaming. Journeys helps you listen to the whispers. There are 3 different journeys to choose from, each designed to meet you where you are in your wellness path. The Core Wellness Journey for $199 offers a foundational look at your overall health, perfect for getting started and measuring 66 biomarkers. The Advanced Heart and Metabolic Health Journey for $339 measures 111 biomarkers and goes deeper into cardiovascular, metabolic, and thyroid health for a more detailed picture. The Comprehensive Longevity and Hormone Journey costs $469 and is the most complete view, including hormone, nutrient markers that support energy, balance, and healthy aging. This measures 120 biomarkers. Each journey includes a personalized recommendation, one-on-one care from your pharmacist, and follow-up support to help you turn results into lasting intentional change. You just won't get data. You'll get guidance, accountability, and a partner in your wellness journey. Intentional living means paying attention, staying curious, and taking steps towards the health you deserve. Start your journeys today. Click the link in the show notes. I thank you for that. I thank you for that, for explaining it in such a way that somebody who has not sat in a pharmacology class can understand. And this is the reason why I invited Jessica to this podcast. And I said, Dr. Jessica, we need your expertise. Come and explain it to us in such a way that my friends who did not go to pharmacy school can understand. Because I was talking with a friend and they were talking about, I don't understand, the whole thing started from Viagra. We talked about Viagra being used for pulmonary hypertension and Viagra being used for erectile dysfunction. Those are 2 separate disease states, and we're using the same chemical ingredient to take care of those.
Yeah.
So if I'm taking Viagra for erectile dysfunction and I'm taking Viagra for pulmonary hypertension, it doesn't mean that I have either of those disease states. And I want to take away the taboo around disease states and encourage discussion about treatment options.
Yes.
So low-dose naltrexone is just one of those options. And I thank you for explaining the strength and how different. Naltrexone dosing for opioid use disorder is 50 milligrams. But low-dose naltrexone dosing is about 4 milligrams.
Right. So just a fraction.
Yes.
A smidge.
So now we know how low-dose naltrexone works in the body. So if I'm in pain now, my physician and my healthcare team will, give me all the options. And if I'm thinking of using low-dose naltrexone, how do I get it? Is that something I could just walk to the pharmacy and get, or what do I do? Yeah.
So the first thing you have to do is it's prescribed.
Yes.
The other piece is it's not at 4.5 milligrams or lower. Low dose is a range from 4 to 9.
Yes.
It's not available in that strength. So that's where a pharmacy like Emlah's pharmacy with the compounding services comes into play. It has to be compounded, which is just an extra step that shouldn't cause a lot of problems.
Not at all.
You just have to get the prescription, get it sent to a compounding pharmacy. They take the capsules, they compound it, down to the dose that is needed.
Yes.
Put it back in capsules, and then you take it just like you'd take any other medication. It's just that extra step of making sure the prescription goes to a compounding pharmacy so that you can get the low dose.
Yes. And that's, and then we be able to get back to activities of daily living. And this, it's just necessary that we know that these tools exist.
Yeah.
And I want people to think, I want to talk about the drug. People are thinking, is this really safe for me? So what about the other medications that I'm taking? Is this safe? Is low-dose naltrexone safe?
So that's where your pharmacists also come into play and asking, saying, hey, here's the other medications I take.
Thank you.
Can you look and see if this interacts with anything?
Thank you.
Right? And then the other not big pieces, but things to be aware of if you are someone taking this or you're talking to someone who might take it is there's a couple of things. So one, it can be something that excites your body a little bit.
Mhm.
So if that happens to someone, it'd be important to say, well, then don't take it at night. Take it in the morning.
Yes.
Then that excitement will happen during the day, and then hopefully your sleep's not affected.
Yes.
The other piece is it can cause vivid dreams, not scary dreams,
Just
but
vivid,
like
yeah.
real life. You feel like you are in Technicolor dreams. And sometimes that might take someone off guard if their dreams aren't like that normally.
Yes.
So making it similar to like
Yes.
rifampin's going to make things turn orange. That's going to scare
It's like,
someone.
oh my gosh.
So making sure they know. But otherwise, I mean, similar side effects as any other, the medication where you might see nausea, that generally doesn't make people tired. It's a fairly benign medication.
Yes.
I'm not saying people wouldn't experience any side effects, but they're minimal. This is a safer option compared to some other things that we might use for pain management. So.
I love that. And you talk about and this is the importance. This is why at Power Pharmacy, we take pride in like every pharmacist, like the goal is to talk with the patient about how you should be using this medication, what you should do to get the optimal effects of this medicine, and what other things. You talked a little bit there about in addition to, and that's one of my favorite phrases in medicine. In addition to prescription medication, what are some of those non-pharmacologic things that we can be using to reduce our pain?
So the big thing is pain will not be fixed with a pill only. There is not a magic pill. It takes ownership of whatever is happening. And this really applies to most chronic disease states. Active involvement in managing the disease state that you have is key. And so learning about other things you can do, movement, any sort of movement. If you feel like you can't move because pain's so bad, but maybe you can move your feet, maybe you have something under your desk, you can do a bike, right? Any movement.
Yes. Any
movement you can do. Also doing things like as you have access to it. I know access is sometimes a little difficult. Additional things like acupuncture, chiropractic. There are psychologists that specifically focus on pain and helping people develop ways to take back control of their life so they don't feel like pain is controlling them, but now you are controlling the pain.
Yes.
And so doing all of these things, like physical therapy, I could keep going, but focusing only on a medication will only get someone so far. It's when you really can embrace all of the other options that are available. There's over-the-counter supplements that can be helpful. And Emlah could help you with any of those because she's an expert in supplements. But just different things, heat, cold. If you have access to maybe sitting in a sauna sometimes, that might make you feel better. Something I do for my pain and people think I'm crazy. I don't think I'm crazy is I sit in ice cold water every single day at 5:20 in the morning for 2 minutes.
Woo!
It knocks down my systemic inflammation and I feel better. So it's just those things, like learning about other things you can do and things that work for you and not thinking I have to go do a full yoga class right now in order to feel better. 5 minutes or do some stretches, like start somewhere with baby steps. And then when you look back, you'll find, holy moly, I've made some progress. So really I've rambled, but it comes down to being an active participant, deciding you're going to own it rather than letting it own you, which can be difficult, which is where, mental health professionals can come into play to really help with that. And I say that because so many people think when I've brought up, I'd love to connect you with our pain psychologist, they say, I'm not crazy. I'm not trying to tell you that you are. She has skills that I don't have as a pharmacist. Our physician has skills that I don't have as a pharmacist, and that our pain psychologist, like everybody brings something different to the table. So being willing to interact with multidisciplinary people to manage pain is really where the money happens. The magic happens.
You heard the lady. Dr. Geiger-Hayes just said, being able to interact with a multidisciplinary team is where the magic happens.
Yes.
I always say this and say always, when it comes to healthcare and comes to your health, don't put the keys of your health in somebody's pocket. Take ownership. Pretend you are the president of the board and those people on the multidisciplinary team are your board members, your physician, your nurse, your pharmacist, your chiropractor, your physical therapist, your nutritionist, your pain psychologist. All those people are on the board of directors to advise you.
Exactly.
And then you take this advice and you be an informed consumer, and then you reach your goal.
Exactly.
So you incorporated those non-pharmacologic options. You incorporated the pharmacologic components. And I say again, there's more to health than prescriptions.
100%. 100%. And I think people maybe look at us funny. We're like, but you guys are pharmacists.
Yes.
That's cool.
Yes.
We can be pharmacists and still think that there are other things besides medication.
Thank you. We're pharmacists. But, the thing is that every time, if you look at the approval, like the FDA approval of any medication, it usually says, in addition to lifestyle changes, this can be used. Yeah, so that's usually, and this is the reason for this podcast, we're looking at things, what else can we do to be able to help ourselves? Thank you for bringing this to our knowledge, and thank you for explaining low-dose naltrexone and taking away the stigma from it. I like the way you teach. Every time I know these things, but when I sit with you, the way you explain it, it makes me feel really good, and that's why I love that our audience to get this and really take away that stigma around pain management and knowing that, nobody wants to be in pain.
Correct.
Our family
Nobody
members
signs up to say, please, I would love to be in severe pain for the next 24 hours.
No, nobody. Nobody. Yes. Time for my favorite part of the podcast, Supplement School with Emlah. And so do not worry, there are no exams at the school. And so, Dr. Geiger-Hayes, I have a question for you.
Yes.
What supplement is on your mind?
I was thinking about turmeric today. And that's
why so?
Because I part of just my journey in managing my own pain, doing that, I really have focused on what can I do to help with inflammation in my body. And there is a lot you can do with your diet to help decrease the amount of inflammation that you experience.
Yes.
And turmeric is one of those not medications, natural products that you can put in food or take as a supplement.
Absolutely. I love turmeric for this reason. Turmeric, when people hear turmeric, the first thing that they think is, curcumin. They're like, it's marketed. Curcumin is just one of the active ingredients in turmeric. There are several different parts that come into play to make this whole turmeric root. It's a root like if you have seen ginger root. I think ginger root is like more common than turmeric root. It just has that strong orange color, and the taste is very distinctive. So people who eat food with turmeric, it's an acquired taste. You kind of have to, yes, you know it's there. This turmeric is something you can hardly hide in food.
And it turns things colors. So being aware of that, if you cook with it, it's in there.
My nutritionist puts turmeric in mashed potato, and she tells her children it is like the orange mashed potato.
Yeah.
Yeah.
I put it in potato soup.
Believed it. Yeah.
And my kids are like, why is the potato soup yellow?
Mm-hmm. What's going on,
That's
Mom?
just yellow potatoes.
Oh, I see. Way to reduce inflammation. That's the reason why I love turmeric too. And I think that's where Dr. Geiger-Hayes is going with this. Turmeric is going. We're reducing inflammation. One of the most common biomarkers for inflammation is C-reactive protein. If you measure high sensitivity C-reactive protein, it kind of tells us generalized inflammation in the body. We want to reduce inflammation. Inflammation is the root of all evil when it comes to chronic pain and many chronic diseases.
It is. Yes. Inflammation. If you can do something to reduce your inflammation, it makes, I noticed huge differences when I started changing my diet. I removed a lot of inflammatory foods, and I'm not going to go down that rabbit hole because there are nutritionists that have probably been on this podcast to talk about that. But you can find lists of inflammatory foods. Ask AI,
I
Google.
love that. Yes.
You can find lists.
I love that, but with turmeric, I also want to caution people when you buy turmeric, every time they're like, if you buy turmeric, you should buy curcumin with bioperine, which is a black pepper, which increases the bioavailability. Black pepper does increase, the bioperine does increase the bioavailability of curcumin. But why extract just one flavonoid from the turmeric root when you could have the whole root
Yes.
itself. So the turmeric, if we will put a link in the show notes to turmeric synergy, which is the Emlah Naturals turmeric, which is the whole complex, the whole root, which is bioavailable for your body. And you take 1 capsule a day, it reduces your inflammation levels. Yeah.
And her vitamins are the best, and she didn't pay me to say that.
Well, thank you. I am honored because I do take turmeric myself, and it's one of those things that helps in addition to an anti-inflammatory diet and helps with that. So thank you very much for being on the show. If you learned something during this podcast episode, please share it with friends. Be a sharing ninja to help other people. You never know who's in pain and who is holding it and not sharing with you. Share this episode. It might help somebody. You never know. Share it. Give us a review on Apple Podcasts, Spotify, and YouTube. So thank you so much for being with us today.
This was awesome. I love to be here.
Thank you.
This is great.
I really appreciate you.
Yeah.